Correct the right one.
Yes. Oh, I think they have you there. There you go.
Okay.
Okay. All right. Good afternoon, everybody. Good to see you all. My name is Michelle Morse. I'm the acting health commissioner and chief medical officer of the New York City Health Department. It is awesome to be here with you and to be here in Wyckoff. I was just saying how when I first started as chief medical officer 5 years ago, I used to talk to your former CEO all the time. It was the height of the pandemic. We were doing a lot of really important vaccine equity work together around the COVID vaccine. And so much has changed in the past 5 years since I started closely working with Wyckoff. I'm so honored to be here today with your new CEO, Ms. Gachet, and it's really, really incredible to get to be here to announce with you this expansion of our partnership through the Relay program, which is the New York City Health Department's hospital-based, peer-led overdose prevention program right here at Wyckoff Medical Center. Relay is designed to bring the comfort of connection to what can be one of the most isolating moments in someone's life, waking up in a hospital bed recovering from an overdose. We make sure that survivors are not alone. Instead, they're met with a kind expression, a safe, non-judgmental guide who sees the best in them at their most vulnerable moments. And our program pairs a peer wellness advocate with patients who recover from overdoses at participating emergency departments. I was just speaking with your CEO and describing the fact that I still get to practice myself as a clinician. I'm an internal medicine doctor and spend a day a month at Kings County Health Center. And I can't tell you how many times I myself, as a clinician, have supported patients through what is, again, an incredibly difficult time, but a time when real, profound change is really possible. So our program that pairs the peer wellness advocates with patients who are in recovery those peer wellness advocates offer support and connection for the 90 days following hospital discharge. And their most important qualification is their own life experience. Our peers accompany survivors towards recovery, and they know what it feels like to start that journey. This program is immensely successful precisely because it recognizes that community and connection are healing. In 2024 alone, Relay offered services to more than 1,700 patients, and 94% of them accepted services in the emergency department, which are, as you know, incredibly exciting numbers. So that's why today we're really proud and excited to announce that we're expanding Relay to its 16th hospital in New York City, right here at Wyckoff Heights Medical Center. Congratulations. For us at the health department, Relay is a critical part of a larger network of care across New York City. We've been consistently expanding our efforts in overdose prevention and harm reduction, and we're beginning to see that progress reflected in the data, which is, of course, one of our many goals. Our most recent data show that the first significant decline in overdose deaths in 2024 following nearly a decade of increases. Overdose deaths dropped by 28% from 2021, and there are unfortunately still persistent racial inequities, but for the first time since 2018, overdose deaths decreased amongst Black and Latino New Yorkers. That also deserves a round of applause. As you all know extremely well, everyone standing up here today and everyone present, these changes don't happen just by chance or passively. They're a testament to your and our intentional efforts to get New Yorkers the support they need. It's a very humbling, of course, experience to be a part of this expansion because we have come a long way in caring for New Yorkers who use substances, and we cannot stop now, even though the curve is changing and bending. I first joined the New York City Health Department in 2021 when On Point opened the first ever publicly recognized overdose prevention centers in the country. And we're really proud to support their work as well, which builds on community as a foundational part of recovery. Within the first few months of me joining the health department, I had the opportunity to visit one of those overdose prevention centers and see the philosophy of community-based care in action. It remains one of the most memorable experiences of my tenure at the health department. And I remember watching someone receive acupuncture to ease their withdrawal symptoms, a practice that has a long history here in New York City. I also remember seeing how much of an impact it made to really center each person's humanity, their needs, their priorities, and not their substance use. And I also remember the feeling of deep solidarity that really laid the foundation for incredibly impactful healthcare, medical care, and substance use care. It is incredibly meaningful to be here 5 years later, with Relay representing the best of public health and being about meeting people where they are with compassion, community, and resources. So again, honored to get to be here with you all celebrating this milestone of our opening of a Relay site in partnership with you here at Wyckoff. Thank you to our peer wellness advocates who make this program possible, some of whom are here with us today and are going to speak. And again, your dedication to this work makes the difference, period. It's my honor to now introduce Val Gachet, the president and CEO of Wyckoff Heights Medical Center.
Good afternoon, everyone. And thank you for coming to Wyckoff, to our guests and the community. We are delighted to have you all here in such a beautiful day. Spring is almost coming, right? So this was a good day to travel. We are extremely grateful to partnering with the New York City Department of Health and Mental Hygiene to implement the ED Relay program and support our patients and our communities that are gravely affected by the opioid overdoses. The Relay program allows us to improve health equity in this community by creating access to these services in real time and at the patient bedside. Our emergency department treats over 80,000 visits and patients per year, and 84% of these patients come from this community of Latino and Black. So it's definitely critical for us to make sure we address the health equities through this program. We have many ED patients that come mostly for urgent medical care, but in the past year, we have seen a significant increase in patients presenting with acute social needs and acute behavioral needs. So last year in 2025, our dedicated ED providers and nurses treated over 3,500 patients whose primary diagnosis was a behavioral health issue, and this is double of what we have experienced in 2024. Our ED also treats many patients with severe and complex social needs. Approximately 1,000 of our patients that we see in ED per year are homeless. During our community needs assessment that we performed this fall, we also learned through patient surveys to multiple interviews with our community-based organizations and providers that substance use service is the second highest need in this community, and mental health service is the fourth highest need for our community. So through this ED Relay program, Wyckoff is partnering with the New York City Department of Health to provide these resources in real time for a patient-centered approach to comprehensive care by using the wellness advocates to add to the clinical care we can provide. This will meet the patients where they are and engage with them in the community where they live. The ED Relay program aligns very closely with our community service plan for the next 5 years. And in that plan, we identified that increasing access to substance use services is one of our main objectives. So this partnership is extremely timely with our overall goal to improve health equity, improve patient access to this community. And I cannot thank enough our clinicians, our nurses, our social workers who support this program, and also the New York City Department of Health and our elected officials for providing Wyckoff with this very valuable resource. Thank you.
Thank you again. And just to underline, I think the health department we feel very strongly that we cannot be successful in our overall goals for New York City without partnerships, particularly with safety net hospitals like Wyckoff Heights. It is one of our most important health equity strategies for the city. And it's the only way we're also going to achieve our overall goals around Healthy NYC, which some of you may be familiar with. The goal is to reduce overdose deaths by 20% by 2030. We're on track, but we are not there yet. So again, this partnership is going to help the city be healthier in ways that we know are so important. I do want to acknowledge the staff of several elected officials who are here. We have staff of Councilmember Gutierrez who are here. Great, thank you. Thank you. We're very excited to work with her in her new capacity as chair of the Mental Health Committee. And then we also have staff from Assemblymember Daviano. Thank you for being here. So next up, I'm going to ask Dr. Lynn Mangiello and Nurse Jamwanti Prasad from the Emergency Department to share some remarks.
Hello, everyone, and welcome. Thank you so much for joining us here today. I'm Dr. Lynn Manganello. I'm the ED champion for Relay in the Emergency Department here at Wyckoff Heights Medical Center. So in our emergency department, Relay is initiated after a patient is evaluated by a provider and they're determined to be presenting for a suspected opioid overdose. A Relay wellness advocate then promptly arrives to the ED to further engage the patient, and they offer them up to 90 days of services after their discharge. Even if the patient does not accept the Relay services, they still do receive from Relay a care bag that has snacks, some socks, hygiene essentials, and also Narcan, and they'll also receive training in how to use the Narcan. So both our providers and patients are very enthusiastic about the services that Relay has been providing to us. We appreciate the time and the expertise of the wellness advocates. They offer a lot of help to us and our patients during an otherwise stressful situation in a busy emergency department setting. Thank you so much to the New York City Department of Health and Mental Hygiene for making these services available to our community, our patients, and partnering with us on this initiative.
Amazing. There is nothing like hearing directly from providers on the front lines about how this kind of work can change real human lives. And along those lines, I just want to acknowledge our team at the New York City Health Department really quickly. Dr. Jean Wright, who is Executive Deputy Commissioner. We're going to have several folks from our Relay team speak in just a minute as well. And before we do that, I'm going to ask Dr. Rebecca Lynn Walton, also from the Health Department, Assistant Commissioner for the Bureau of Alcohol and Drug Use, to share a few remarks as well.
All right, I forgot my glasses. All right. And I'm short too. Thank you, Dr. Morse. It's an honor to be here today and share this proud moment with the peers, our partners at Wyckoff Heights, and most importantly, the New Yorkers struggling with opioids and other drugs. My name is Rebecca Lynn Walton, and I'm the Assistant Commissioner for the Bureau of Alcohol and Drug Use. At the Health Department, we are working every day to save lives and help people heal. Dr. Morse spoke so eloquently about our data and overall strategy. Our colleagues at Wyckoff Heights spoke to their work, and in a moment, our peer wellness advocate is going to speak about his work saving lives every day in the compassionate work he does to save those lives. This work is both professional and personal. 24 years ago, I was struggling with opioid use disorder. When I had a non-fatal overdose, there were no peers to sit bedside with me. This work was just at its beginning. When I was in treatment, someone was brave enough to tell me they had been where I was, and it's because of him that I get to stand with you today. When I was in training, I was told the worst thing I could possibly do for the people I was helping is share my own experience with addiction and mental illness. Thankfully, we know more today, though many in our field still face stigma when sharing their experience. The Relay program is healing both for our wellness advocates and for those they serve. Each time we tell our story, we shine a light on the darkest moments in our lives. Though that can bring up pain, we are taught how to do so without reliving the hurt, how to share our past and hold out our hand for the person who's struggling right now. All of the work we do at the Bureau of Alcohol and Drug Use shines a light on the pain to bring healing. Whether it's overdose data to inform communities and scientists about programs, drug checking to identify new substances in the supply and how to adapt our response to save lives in real time. Using opioid settlement dollars to fund recovery centers, the Relay program, same-day medication access, and counseling and other support at harm reduction programs like OnPoint. Nurse care managers in primary care providing buprenorphine every day in a brand new setting. Overdose education awareness and naloxone kits. Outreach teams, training for our community partners, and convenings with communities to have their needs drive our work. Each piece moves this work forward. While we are making some headway in reducing overdose deaths, we still lose a neighbor, a loved one, or a colleague every 4 hours in New York City. We have a long way to go yet. The health department will be there every step of the way, hand in hand with our community partners like this hospital. Thank you, Wyckoff Heights, for partnering with us, and thank you for your commitment to this life-saving work. We are proud to stand alongside you.
Thank you again, Dr. Walton and Lynn Walton, and thank you again for sharing your real life experience with us as well. Next up, perhaps one of the most important people up here, I'm going to ask Alan Dorville, who is a Relay peer wellness advocate, to share a few words as well.
Okay, there we go, right? Good afternoon. My name is Alan Dorville, and if you had told me decades ago that I would be here today, I wouldn't have believed you. I'm so grateful to be able to use my lived experience to connect with people who are struggling with substance use. For the last 20 years, I have worked in many different roles to connect New Yorkers to resources that prevent overdose deaths and support recovery in many different ways. I am proud to stand here today as a wellness advocate and a Brooklyn resident to tell you none of these models compared to the work I now do through Relay. Go Relay! That's right. Meeting clients directly where they are at the hospital after they have overdosed allows my colleagues and I to connect people to resources and tools they didn't know were available. Most importantly, it creates an opportunity to give someone hope and to give them options. There is no cookie cutter approach. Each individual and their circumstances are unique. I speak to people authentically and without any judgment, and listen very carefully, right, for what they need in that vulnerable moment. Often what they need is reassurance that they are not alone. Building that trust can start with something as simple as getting them a glass of water, and from there, I'm able to open a conversation. Nearly 4 years into my work with the health department, I am reminded every day that lived experience is one of our greatest strengths to connect with New Yorkers to prevent a future overdose. As a peer, I'm not there to diagnose them or treat them. I'm there to help them, keep them alive. I'm going to repeat that again. I'm there to help keep them alive. Those few moments of connection can make all the difference in helping a client find ways to stay safe and avoid high-risk behavior in the future. Starting the recovery process looks different for everyone. For some, that means teaching them how to use naloxone and connecting them to a nearby provider. For others, it means reminding them that if I could get off the dangerous path that I was once on, they can too, and that they don't need to do it alone. It was a dangerous path, but I'm grateful that I'm now on the path to recovery. This is not just a job. It's a mission to save lives, and it's working. I look forward to continuing our collaborative efforts to reach more people. Thank you.
Thank you so much, Alan.
Thank you.
You can see why 90% of people say yes when they meet one of our peers in the emergency room. And because of Alan's work and so many others at the health department, I myself, I hope you do too, carry a naloxone kit everywhere I go in my backpack. That's the littlest thing we can do. And then finally, are we going to have any elected? No, we're good. Okay. All right. So with that, those are all the comments we wanted to share. I'll pass it over to William for Q&A.
Yeah, we'll do some on-topic questions from the press. Anybody has a question? Going good? Okay. Patrick?
Do you have an estimated cost of implementing the more wellness advocates or the 90-day bag or anything like that?
You're asking specifically for the cost of expanding to Wyckoff Heights. Dr. Lynn, can you share?
I'll have to get back with the exact budget, but just the important piece for me is this is part of opioid settlement fund dollars, and so this is going right back into the communities.
Now we're just going to do on topic. Any on topic questions? No? Okay. All right. Thank you, everybody.
Thank you.